Hey everybody, my name is Astra and I'm 17. Since I was little, I haven't really had a chance to interact with other people. That's because my mom and dad were too strict. They often got on fights when it was happening. I was in trouble too, so I got a fear of people. I no longer trusted them, even when they were nice to me. Throughout my school years, I was all by myself. I avoided other students and tried to be mediocre to avoid unnecessary attention. I was afraid of answering questions before the class and got scared every time the teacher called my name. I expected nothing but scolding and debunking. I didn't really have any happy memories of my early life. Just my passion for drawing. The energy that I didn't spend on communicating with other people was accumulating, and it made me feel bad. But later, I found myself in drawing. I was developing my drawing skills as much as I could. I used pencils, paints, I tried all the styles, and finally found my own. My life no longer seemed so sad, but when I was 15, terrible things happened. Our neighbor killed my parents. We knew that she was mentally ill, so we tried not to bother her. She used to be a patient in a mental hospital, but for some reason, they released her. She was taking some pills, and they seemed to work just fine. But that day, apparently she forgot to take her pills. My parents were having a fight, a major one. I locked myself in my room, turned on my music, and tried to ignore the loud screams. But then I heard some strange sounds, and it suddenly became quiet. I got scared. I waited for about 5 minutes, and it was still quiet. I came out of my room and saw my parents. They were dead. I immediately called the police. The neighbor's guilt was proven, and she was arrested. I moved out to stay with my aunt. No one could imagine what was going on in my head back then. Relatives tried to comfort me, but their presence was annoying. I wanted them to just leave me alone. I wanted to lock myself. I hated to see people around. I just wanted to be all alone with myself. You probably think it hurt a lot, but you are wrong. I didn't feel anything. I was even glad to some point. No one would ever yell at me ever again or threaten me. I could live a peaceful life, I thought. But things didn't work out this way. I felt ashamed of being glad about my parents' death. And I reproached myself for this. Staying home all the time was turning me into a caveman. I didn't want to go anywhere. My aunt did not love me at all, and it was a burden for her. I got to the point where I didn't even want to take a shower or wash my face. I wasn't taking care of myself, but spending days in my bed thinking about different things. I liked it this way, but my aunt said I was doing wrong and I had to spend at least a little more time with people. And take care of myself, of course. But I turned a deaf ear on that. I simply didn't listen to her. I did not listen to anyone. It might seem I was all alone, but I was talking with my imaginary friends. I've had them since childhood. And at that time, they were especially close. I had no one except them. We were having fun and sorrowing together, and all of that was happening for real. Then I began to get hallucinations, and this was the worst thing. It seemed to me that somebody was knocking on my door and trying to break into my room. I saw my parents scolding me, and it was especially creepy at night. I left the lights on, but it didn't help. In addition to my parents, I saw images from horror stories that I once watched. Scary creatures that wanted to get me. Some even beat me. And when it turned out that I was beating myself, my aunt did not care about me. She brought me food and water, but never tried to talk to me. But when she discovered I was having some issues, she did take me to a psychiatrist. On the way to the psychiatrist, I saw scary creatures sitting behind every corner, and they were watching me. After an interview and a few tests, a psychiatrist said that I had paranoid schizophrenia. Unfortunately, there were no cures to get rid of it completely, but there were some special pills that suppress the disorder. They put me in a cell with other patients just like me. My schizophrenia was progressing. I was having emotional decline. It seemed my feelings were fading. I was turning into an indifferent person. In all respects. Things that used to cheer me up would no longer matter. But then, all of a sudden, some other things began to affect my spirits. I didn't even care that my aunt was hospitalized due to progressive diabetes, but when the nurse dropped my pillow, it almost made me cry. And this no longer seemed strange to me. I got used to it. I also got speech issues. I was so much into my inner world that I didn't even think of approaching other people. I was losing my speaking ability. I could stay silent all day and I was fine with it. Leaving alone my hallucinations, they became more frequent and intense. That was a scary situation. But there were some good things about it. Although I couldn't stop seeing images popping in and out of my head, I decided to make use of them. I asked the nurse for a pencil and a paper and began to create. I drew all the images I was seeing. My creativity has progressed significantly. Creepy and creative images coupled with my drawing skills resulted in magnificent works of art, unusual for ordinary people. It was a routine for me. Through drawing, I expressed my vision of the world and reality. It comforted me. After treatment, I felt better. Gradually, I began to recover. Soon, I returned home and continued drawing. My hobby became the point of my life. I was even invited to participate in an art exposition where my works were praised by experts. Thanks for watching. Like the video and subscribe to the channel. Write in the comments whether you've heard of schizophrenia and describe your attitude towards people with this disorder.
Yes, I'm Minusha Bafshar from Iran.
Okay, nice to have you here. We four are here. We're going to start with our topic, schizophrenia, right? So let's divide the questions among us. We have 5 questions here. 6 questions, sorry. First is, what is schizophrenia and its various types? So who would like to start? Anybody wants to volunteer? I can start as well. So I'm going to start with the topic. This is me, Saman Zafar from Lahore, Pakistan, and I am a counseling psychologist. Basically, I did my specialization in counseling psychology, and so today's topic is related to the major mental health issue, which is schizophrenia, and it is DSM-5 through which we diagnose, not we, the clinical psychologists diagnose this disorder, and DSM-5 has a standard to diagnose to see the symptoms of these the people with this condition. It's basically a clinical. There should be a presence of 2 or more of the following, and each for a significant portion of time, like it's 1 month period, with at least one of them being the main theme is delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and the fifth one is related to the negative symptoms. They are negative symptoms. And for a significant portion of the time, since the onset of disturbance, their level of functioning, like related to their professional life, their work, or their interpersonal relationships, and self-care should be markedly below the level of achieved before onset. And the continuous signs of disturbance persist for a period of at least 6 months, which must include at least 1 month of symptoms. Okay, anybody would like to add any point I missed in this definition, in this basic definition? Sandra, would you like to add something in it?
Okay, I can say in DSM-5, schizophrenia is classified under the broad category of schizophrenic spectrum and other psychotic disorders. And for schizophrenia, it's a brain disorder, which is chronic, like lifelong. And it's characterized by an individual having abnormal social behavior and having a failure to recognize what is real and what is not real.
Right, they lose their contact from reality.
Yes.
Okay, so when we see a person or patient with schizophrenia, the normal outlook, the main major concept is related to their absence from reality. You have to see that their orientation, check their time orientation, the place orientation, and then their self-care, how they are being able to take care of their self, and related to their jobs, how their relationship with their family, friends, and these are very important points basically. There are 6 types of schizophrenia, and the first one is paranoid schizophrenia, and actually it is exaggerated in movies. They in the general view of paranoid schizophrenia is quite scary according to the media point of view, but if we see it from the clinical side of the thing, they have this they have this mind of not of having this fearful doubts about people chasing them, or they are not people, they don't trust people or scenarios and things with their lives. They are scared deep down in their hearts, and they make some patterns or rituals to protect themselves. It is difficult to take them to the hospital or clinic and make them convince to see the see the clinical psychologist or doctor. Basically, it's a kind of schizophrenia. They have the positive symptoms in them. The positive symptom is a clinical term. It's not that positive psychology. The clinical terms, the 2 symptoms, the positive symptoms are delusions and hallucinations. So we're not going into very much details because there are types of delusions and there are further types of hallucinations, but we are just summing it up related to paranoid schizophrenia. Okay, anybody would like to comment on this point?
Okay, according to DSM-5, we have numerous types of schizophrenic disorders, which includes delusional disorder, we have brief psychotic disorder, schizophrenia, We have substance or medication induced. We have schizophrenia due to another medical condition. We have catatonia.
Yes.
We have specified and unspecified. The difference is majorly the duration and the symptoms, but most symptoms are similar. The difference is duration of the symptoms.
Okay, right. Like, I'm going to move to the second question because we have very less time here. This is, what are the causes of schizophrenia? So basically, we are going to discuss the reasons, the causes, how and what factors are contributing to this disorders. Basically, it's there are three major things that they are not, you say, we are not even very clear about them. This is the factor genetics. Genetic has a role in it when we see the etiological factors of schizophrenia. Anybody want to add any more point? Truth. The causes of schizophrenia.
Can I add more information about symptoms and cause of the schizophrenia?
Yeah, yes, that would be
Thanks.
great.
Thanks. There are two kind of the symptoms. The first kind is positive symptoms. The term positive symptoms and cycles are generally used to describe the same symptoms. As you said, hallucinations, delusion, disorganized thinking, hallucinations including auditory, visual, and olfactory.
Right.
And about negative symptoms, there are symptoms that involve loss of ability and enjoyment in their life. They can include the following things: lack of motivation, slow movement, change in the sleep patterns, poor grooming or hygiene, difficulty in planning and setting goals, not saying much, a lack of eye contact, reduced range of emotion, less interest or hobbies and activities, low sex drive. And about cognitive experience, as you know, I'm Master of Cognitive Science. We can add more cognitive exercise about schizophrenia disorder. They being unable to sustain attention, memory problem, unable to take on information, and poor decision making. And about the cause of schizophrenia, as you told, yes, genetic is most and very important factor to cause schizophrenia. But I can add some other factors, for example, brain chemistry, genetics, as you told, and birth complication can cause schizophrenia.
Right.
Actually, some people can develop the illness as a result of a stressful event, such as the death of loved one or a lose of job. Actually, even the lose of job can cause schizophrenia in people. Exercise like growing up in the town or city, stressful life events, and moving to new town or country can also make all symptoms for schizophrenia. Actually, there is a strong link between the use of the strong cabins and development of schizophrenia.
Right.
As you listen, there are many factors can play important role to cause schizophrenia. Then I can't, and research and knowledge can say there is one cause can lead to schizophrenia in people. Actually, there are several factors, even related factors.
Right.
Thanks.
You're welcome. You have covered quite much area of schizophrenia, like you have explained us the signs, symptoms, and the causes, in which we can also mention the effect of drug. Can the people who are taking drugs, like abusing drugs, they can it can cause changes in their brain chemistry and trigger this condition. There is another point which is related to birth complications, that some birth complications and issues during the delivery can cause schizophrenia. Brain changes, uh, chemicals, as you mentioned. Now we're going to the next question. That is, we have covered the signs and symptoms basically. We are going to discuss what if schizophrenia is left untreated. If it is left untreated, what kind of complications can occur? I think severe problems that can affect every area of a person who is diagnosed with the schizophrenia, and the complication can be associated to the suicide attempts and thoughts of suicide, uh, anxiety disorders, OCD, depression, and abuse of alcohol or other drugs like nicotine, and they will lose the ability to work or attend their school or colleges. Financial problems can be the result if it is untreated. Social isolation, they'll keep themselves isolated, and health and medical problems, aggressive behaviors. So prevention is better than cure, and there is a need of awareness among general population related to this mental health crisis, I will say, this disorder, schizophrenia. So how is it diagnosed? Rina, would you like to add anything in it? Rina mentioned that I will only listen. So Sandra, uh, tell us, how is schizophrenia being diagnosed and who diagnoses it?
Okay. For diagnosis, it can be done by a psychiatrist or a clinical psychologist. And because it's a disorder which affects the brain, meaning it changes the structure and the functioning of the brain. So scans like CT scans, MRI, PET scanning will help the person who will do the diagnosis to know if there is change in structure or functioning of the brain. Then we have cognitive tests, which is done by a psychologist or a psychiatrist. We have personality tests like MBBI. We have projective tests like InkPlot. We have tools, assessment tools, like positive and negative syndrome scale. We have brief psychiatric rating scale, which is we have for young children and for adults. And we have the clinical global impression for schizophrenia. And for the negative symptoms, which are like depressive symptoms, we use PHQ-9 to identify if the symptoms are present.
Right. Thank you very much for this detailed response, this detailed reply, and you have explained us in a detailed manner what kind of tests and assessment for every symptom of schizophrenia is needed. And now we are coming to the final question, like second last question, that is last question. What is its ultimate treatment? The ultimate treatment of schizophrenia. I'm adding a little part of it, and then I will like the truth to add some part, and then Sandra, we will cover it all. Okay. The schizophrenia, as you told earlier, that this is a lifelong condition, and so its treatment it requires lifelong treatment. Even when symptoms have subsided, treatment with medications and psychosocial therapy can help manage the conditions. In some cases, excuse me, hospitalization may be needed, and a psychiatrist experienced in treating schizophrenia usually guides treatment. Those psychiatrists who are experienced. The treatment team include a psychologist, social worker, psychiatric nurse, and possibly a case manager to coordinate care. It's a full team approach, and it is needed. It's like a teamwork. So, Truth, how would you add anything in the treatment, like for the people who don't know how to get their loved ones treated, and what is the ultimate treatment? Kindly add something. Yes, Truth.
I think you described all things so complex. You told all things by all detail. So I can't say anything because you told all things with more detail and so complex. But for schizophrenia, in my view, I most prefer this patient should firstly give drug and get pharmacology therapy, and then psychology can do the therapies for this patient. I can remember I think 4 years ago we had patient with schizophrenia. For some people around her, she cut her drugs, and she going worse and worse. She got more hallucination and delusion, and her family couldn't control her because people say her she gets drug. Then in my experience, I prefer more these people with the schizophrenia should firstly have drug, and they use drug. After that, for example, after 1 month later or 2 months later, they can start the therapy by psychologists or counselor and psychotherapists, and even though occupational therapies.
Right.
Thanks.
Thank you, Sandra. We have covered almost all the parts. How would you like to give some conclusive feedback to this session today?
Our today's session was about schizophrenia. We have seen its brain mental disorder, which is chronic, meaning it's lifelong, And we have the different types of schizophrenic spectrum disorders. We have seen of how we can diagnose a patient having schizophrenia, the signs and symptoms, which includes the positive, the negative, and the disorganized speech. Then we have seen the causes of schizophrenia, which are majorly genetic and environmental factors. And finally, we have seen the management of schizophrenia, which we have discussed it that it entails use of prescribed medications, which is also lifelong. The prescription must be lifelong. And we have also the psychotherapy or the psychological management. In addition, we have rehabilitation because mostly schizophrenia affects the skills, the life skills of a person, employment. So we have to do rehabilitation for the person. And also we have to teach the person social skills so that it can apply like self-care, socialization. I think
Yeah,
that was a great presentation.
right.
I came back to you, Safa.
Thank you so much. And finally, I would like a family therapy is also given to them so that their family is also aware of the situation and help them throughout the period. And one more thing, uh, for adults with schizophrenia who do not respond to drug therapy, as Truth was mentioning her case, that woman was not responding to the medicines, ECT may be considered sometime electroconvulsive therapy. And I don't know about the ethical dilemmas related to ECT, but there it is being used in some areas of the world. So the support is very much needed from the community, family, and people around them. We need to spread more awareness about schizophrenia and stay focused on the goals, like keep it going, don't stop the treatment, and help them avoiding alcohol or drug use, and they should ask about the social service assistance in their areas. And I think that's all. We are running out of time, so thank you very much for joining and for your contribution to this interesting topic. Thank you, Sandra and
Thank you.
Truth. Rina,
Thank
thank you.
Yeah, it was very interesting meeting. Thank you very much.
You're most welcome. Hopefully, we'll join some other time. We will meet, and take care of
Yeah,
yourself.
you too.
Thank you. Thank you for
You're
saying more
welcome.
detail about the schizophrenia.
Thank you so much. Bye bye.
Thank you. Goodbye. Goodbye.